Welcome to an hour of Health Made Radio. Health Made is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. Our core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. Health Made Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Brenden Cochran. Dr. Cochran, you're very well-known, well-liked naturopathic doctor, and you do speaking engagements, I know, all over the United States. Tell me a little bit about yourself and what drove you to become a naturopathic doctor.
Yeah, thanks, Carl. So I'm a naturopathic doctor. I practice in just north of Seattle, Washington. And then I also work kind of remotely and indirectly with some other providers around the country. And kind of the whole drive was I was originally going into pharmacology, and I really liked all the biochemistry and the science and a total understanding of really how things work, how to support different pathways to get the most efficient results. And I was doing this while I was an undergrad at the University of Washington getting my chemistry degree. And I ran into a few people in my profession who had been pharmacists who went back to school and got their doctorate in naturopathic medicine. And they kind of shared their stories, and I hung out with them. It just opened my eyes to how many more tools we could have. So I pursued going to school and went through school and met some really great mentors who kind of kept that whole mission going of really intense biochemistry, understanding full function, and using many different tools and certain equations to get results with patients. And when I saw that, it was very defining to say, hey, we can get results with this medicine, whether it be with natural therapies and with some things that are conventional therapies. And it's awesome that we can blend those two things to get the best clinical outcomes.
Yeah, and that becomes really important, especially now we're dealing with this COVID crisis. And then we need to utilize as many tools as possible to be able to kind of navigate all the symptoms people are dealing with, and also to minimize the risk of treatments. And I know repurposed drugs is something that is really a hot topic. Tell me a little bit about that and how that can be used with people battling with this pandemic, so-called, that we're dealing with.
Yeah, so repurposed drugs, along with everything we do in natural medicine, some of the supplements, IVs, everything else is extremely important. We saw when this first hit, we were trying to find what are some simple solutions that we could use, what are things that already exist that could be quickly applied. And we went through this and we kind of compared notes with multiple different doctors from out the world. And we have a pretty good understanding now of those drugs that are relatively cheap, been around for a long time, they're cheap drugs, of how they could be supportive and beneficial in a person who has COVID. And I think that, unfortunately, there's a huge controversy right now of not using one, which is a huge disservice because, as you and I know, any chronic disease, any acute disease that we treat, we never address it with just one tool. We always hit it with a multiple-pronged approach. And so right now we're kind of in this cusp of, I think, most of the public being told there's only one solution and one answer, or, there is no answer. Just go home and just ibuprofen or Tylenol and call us if it gets really bad. I think it's a huge disservice to patients and to people to send this message out. There's tons of things we can do ahead of time and in the throes of things to improve our outcomes with patients. So there's a couple of them that I want to just talk about. Some of them people may know about because they've been on the news more and kind of gaslighted or hidden a little bit more and said they were only used for one thing. And there's a few others some people may not really think about as something that you should consider looking at. One of the easiest ones to talk about that's been around forever, and I think it's a good drug, safe drug, and if you're a candidate where you're having blood sugar issues, is a drug called metformin. There's been literature showing that patients who had either type 2 diabetes or prediabetes or just glycemic issues, that it tends to improve their outcomes when they're on it, or if a patient is put on that if they're not already on it. And the other amazing thing about it is most of the studies are showing you don't need a very large dosage of the drug itself. A low dosage of it works fine in those cases. Some of our most susceptible patients are, of course, the people who are mostly inflamed because they're either overweight or their blood sugars are especially high. And so if we can, of course, address those people with diet lifestyle, but then if we need a tool kind of as a bridge drug or something short term, I definitely think it's one valuable option that we should be considering and using.
So you're telling me then actually that metformin, I know we use it as a repurposed drugs for cancer, and obviously it's commonly used for type 2 diabetes. So it's also helpful in COVID, and how is that?
Yeah, so the biggest thing that we know, some of the studies that have been done with it are basically looking at people in a metformin group and a non-metformin group, and they're examining specific details like, okay, how many of these people went to the hospital versus the non-metformin group? And then when they were also given metformin versus not metformin, how many of these people got severe lung disease or even died? And it tends to drop that percentage significantly. And the reason it's doing that is, if you remember, anytime your blood sugar goes up, it causes an inflammatory response on the endothelium. And when we inflame the endothelial lining in your blood vessels, it drastically increases your risk of having blood clots, poor circulation to specific tissues. The other thing that I don't think it's talking about that much, which I do believe is going to be a critical finding, is we know that metformin has an aspect of manipulating your gut bugs or your microflora that live in your GI tract. And we know that a large majority of your immune system and the health of your immune system is dependent on your gut bugs. And this specific drug, we've learned over the last couple of years that it manipulates some of that gut flora, which definitely could be playing a role in how you regulate not only glucose, but also the immune system. And I think that's one of the reasons we are using it a lot in integrative oncology settings and cancer settings as well.
So let's just take a quick break, and I have some more questions in regard to metformin, in regard to some of the negative effects, or if there are any, and any concerns. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Brenden Cochran. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Brenden Cochran. Dr. Brenden Cochran, we're discussing the use of repurposed drugs while battling COVID. And Dr. Cochran, you were talking about metformin, and that makes complete sense since it does. You have all these kind of ACE2 receptors where the spike proteins lock into, and they have a lot of that along the endothelial lining, and then also along the digestive tract as well. So, and then if you can control that inflammation, you're able to then obviously have a better outcome in regards to what's happening with COVID, but also if you're forced to take the vaccine, it is important then to be able to control that inflammation and minimize clotting and so forth. So metformin is that safe for everyone just to do, or I mean, are there certain concerns that people should have while taking it?
So generally, this drug has been around for a very long time, and it is safe for a majority of people. Now, there's a few exceptions for number one issue with safety for this drug is depending on people's kidney function. So if people's kidney function gets too low, there's a specific lab called GFR, estimated GFR, which looks at your filtration rate of the kidneys. If that gets too low, then it's not something that we often recommend to people because it can cause things like ketoacidosis or issues in people. From us, that's mainly the big, like, absolute, hey, we need to pick something else or don't use this drug. From a side effect profile, the dosages we're talking about, for COVID-related patients or, your integrative oncology, most of the time we don't often see the big side effects, but it is possible. Most of them are GI-related, so initially it's either nausea or diarrhea or gas. We often start lower dosages and then ramp up because as the GI system gets used to this, most of the time people's symptoms go away pretty quickly. There are the exception of some people that just can't tolerate it, but it's pretty rare. From a long-term perspective with this specific drug, the biggest one we worry about is depleting B12 stores. So most of the time, your physician will often advise doing something either sublingual or so it's under the tongue, or doing something that's an intramuscular injection or IV to make sure that those B12 levels don't drop. There are labs out there that we can measure this as well, but typically we just give that to prevent any possible issues that may develop. But otherwise, it's a very safe, it's been around for a long time medication. And it's actually derived from a natural plant.
Oh, tell me about that.
So, metformin's, the development of metformin actually came from, like most medications that are out there, actually was derived from an herb. And there's another plant that's similar actions to metformin that is an herb. It's called berberine. And some people we use berberine for as kind of a stepping stone if they don't want to do metformin or say they're in those lower kidney function issues. And some people, we find that it works really, really well, and other individuals, we need something stronger, and then we just jump to straight metformin itself. But the beauty of it is metformin, basically, it has other actions, like you were saying with the ACE2 and stuff, but it works on people. Specifically, we know it works on something called AMPK, which is really important as you're aging, and it's important in mitochondrial function. And it's also being used in other instances like polycystic ovarian syndrome. So we've used it for many other applications other than just your, diabetic, for a diabetic individual. Yeah.
So in regards then to, so metformin, that's something that a lot of people don't know in regards to COVID. Mostly we hear about ivermectin, hydroxychloroquine, and we'll talk about that a little bit later on. Are there other pharmaceuticals, repurposed drugs that would be very useful other than the hydroxychloroquine and ivermectin?
Yeah, so let's just select a few more before we get into the big hot topics that you were talking about. Another one that's kind of gaining traction, I think we have just a small group, is looking at either using fembrates and fembrates are known as a cholesterol-reducing medication. They work similarly to statins, a little bit different enzyme that they work on. And there was actually an interventional study out of Israel where they took patients who were heading in a very bad situation, so they're admitted, to the hospital, and they compared it to the standard of care, which is remdesivir, dexamethasone, plasma convalescent antibodies, and heparin treatment. And they just gave, the other group was 145 milligrams of Fembrates. And the cool thing in this study is it showed dramatic reductions in hospitalizations and progression of disease when people were taking this. And again, it was a very small group. It was like 15 was the sample size. But it's a really good one to at least look at and consider if you're heading in that direction and you need something else on board. The basic chemistry behind it makes sense. It actually destabilizes the COVID virus. It does increase AMPK, similar to what metformin does. It does some cool things at reducing platelet aggregation, and it really does a great job of dropping a lot of inflammatory cytokines. So it has some potential to use, and I don't see why a person wouldn't really use it, because the safety profile on this drug for short term is really something worth giving a try.
And how about things like Cinepril? That's an ACE inhibitor. Is that something you feel will be a useful tool as well, or is that something that you looked at?
Yeah, I have looked at that, and I think initially when we came out, everybody was like scared and didn't know how it worked, and they said get off your life. Consider changing your medications from lisinopril over to something else, and I think. I definitely think it has a role in there. I've looked at it. I think there's another drug that we use for blood pressure that seems to be having a stronger effect, and it works on blood pressure, and it also does some other things with hormones. Then I favor a little bit more lisinopril. Now, if you're already on lisinopril, definitely keep taking that unless you've consulted with one of your doctors and your doctor's is making some change. So you want to be medically supervised. But I think if I had to pick between lisinopril and this other drug is called spironolactone, and from what I've seen and what I've kind of dug into, it seems like this one would be a better option if you're using it for, say, a 10-day course. And it has more mechanisms of action than just the ACE2, which we see with lisinopril.
So what are some of the other functions that people should look at? Because most what we hear is we want to block the receptors, so the spike proteins can't attach. And then, you were talking about reducing inflammation along the endothelial lining to reduce clot risk, which is obviously very important. But what are some other things that are important to kind of look at in order to protect yourself?
Yeah, so other than the big ones that we talked about, of course, clot risk, inflammation, and kind of deactivating the virus from attaching, the other big one that I think we'll address with some other drugs later that are more hot topic drugs is stopping viral replication so you don't get this viralemia or this toxic viral load that overcomes you. And that typically is done early. So if you get COVID or you have COVID, everything you can do to kind of get your immune system tuned up so that you can slow down the replication time is critical, so you don't just get walloped by this. Another one that I think is also coming up is there is some people talking about hormones, and specifically in men, excessive androgens may be a problem, and estrogen in certain amounts may be beneficial. So here's the thing with estrogen. If you get too little of estrogen, you have problems with neurodegeneration and fatigue and problems that go awry. If you get too much estrogen in the body, that also becomes problematic and can increase clotting risks and whatnot too. And so some of the drugs we're looking at will have an action on manipulating or balancing out that excessive androgen production and shifting a little more estrogen. The final mechanism
that can be helpful, and that can be helpful during COVID.
Exactly. Especially it seems to be in males because they're one of the observations we've noticed is in males they're having a rougher time with this than some of our female population. And so one of the theories looking at this and some of the papers that have been published has been looking at either excessive androgen therapy or something in low estrogen, for example, or excessive estrogen is a problematic issue. So another really big one, and the thing I don't think people are talking about the most is I really believe that the reason certain people have such a struggle with either COVID or long hauler symptom, it goes back to what we've talked about, Karl, with some of our cancer patients with every chronic disease is their mitochondrial health. Patient who has poor mitochondrial health is going to have more issues with this virus, just like any other health issue that comes up.
Yeah, and what they've seen is that the spike proteins, and this is also an effect then from people getting the vaccine, because you get a higher load of spike proteins, is that it actually downregulates in the mitochondria, and that obviously opens up for just a slew of health conditions that can ensue from just that impact alone.
Absolutely. So we see this with people who get COVID, and we've seen this with people who have implications of adverse effects from the vaccines that we're seeing. It basically is damaging the mitochondria, and interestingly enough, why do when people are describing that they're having these severe muscle aches going on, what you're seeing there is it's deprivation of oxygenation or mitochondrial function. That's what's causing that severe pain. When we see these people with brain fog issues or chronic fatigue issues popping up, that's also a replication of mitochondrial function. So I think that one of the things we need to think about as a profession in medicine is what we're doing is both people getting this infection and getting hit hard with this, or people that are having an adverse effect from the vaccinations. We need to really be focusing on what is your mitochondrial health and what are strategies that we could use to maximize mitochondrial function.
Awesome. Well, let's take a quick break. I want to expand on that a little bit more because that's something that's talked a lot about. Understanding what you can do, to activate the mitochondria. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I am here with Dr. Brenden Cochran. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Brenden Cochran, and we're talking about repurposed drugs and how they can be useful while battling COVID, and also some of the other implications. And one of the implications is the mitochondrial dysfunction and how important that is to address. So what are some of the tools that people can use to be able to then activate the mitochondria and keep it healthy so that it can so people can get through what's going on right now?
So I'll list a few kind of some supplement things and then other interventions that we use. Probably one of the most well-known ones that people take is CoQ10, ubiquinol or ubiquinone. We've known that is essential in upregulation of ATP production and the electron transport chain with mitochondria. Another one that comes up a lot is is something called alpha-lipoic acid, and it has been seen in medicine to be used in people with mitochondrial issues that resulted in neuropathies, cancers, chronic fatigue syndromes, and even, awesome thing that came up is there's an old research trial, Carl, all these people are losing their sense of smell. There's a research trial out there looking at using alpha-lipoic acid. This is back in 2009 for other viruses, and using alpha-lipoic acid to restore people's sense of smell. And I think that part of it is not only the neurological damage that you're seeing there is due to a direct impact on mitochondrial function. And I think that's why we're seeing that as an agent that worked back in that study in 2009. And clinically, I've found it helpful in these patients who are losing smell and these people who are having mitochondrial issues. ALA can be given as an IV. We give it orally, or there's also a really awesome form of it called lipoic acid mineral complex, or poly-MVA. And I think I like that one just because it has a lot of other ingredients in it that are essential for supporting the cofactors that are needed for mitochondrial health. Other things that we use in our clinics, and I'm sure you use as well, is we know that hyperbaric oxygen is critical in improving oxygen delivery. We also use ozone therapy, which is amazing at increasing oxygen utilization, which is basically our ability to deliver oxygen to tissues and cells. And we also use photodynamic therapies. So we're using laser treatments or different colors of light spectrum to activate mitochondrial function. These are just some of the various tools that we use in clinical medicine right now for general mitochondrial health. To another,
they have simple things like B vitamins and magnesium and L-carnitine and those type of things as well, right?
Absolutely. So those are kind of I call them the foundational stuff. Every single pathway in biochemistry requires B vitamins, and I'd say every person on this planet who has stress is deficient in B vitamins and magnesium.
So that is every person on this planet.
Pretty much every person on this planet needs B vitamins and magnesium, exactly.
Yeah. That's awesome. Well, let's take the last break, and I want to make sure that we have plenty of time to discuss the two hot topics, so we don't miss out on those. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. You're here with Dr. Brenden Cochran, and we're discussing repurposed drugs in regards to COVID, and we're going to chat a little bit more about ivermectin and hydroxychloroquine. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Brenden Cochran, and we're discussing repurposed drugs in regards to COVID. So ivermectin, like you're saying, it's been gaslighted. It's been gone after. Doctors, I think they've lost their licenses because they have prescribed ivermectin. It's something that's been around for a long time, and what's going on with that, and why is it so gone after, and is it safe? Is it effective?
Yeah, I think it's right now we're in kind of this midst of medicine where everybody just started using it, and for whatever reason, we have decided to prioritize only a couple therapies instead of using a relatively cheap. It's a cheap drug. It's readily available. It has a very amazing safety profile, and it's been used in multiple different conditions since it first was published in 1979. Basically, the person who founded it got a Nobel Prize on it. Its usage, and you're exactly right. If we look at clinical studies where they're either meta-analysis where we're examining populations of people who are using ivermectin or doctors who are using ivermectin, and even some randomized trials that looked at people using ivermectin, it seems that it, especially when it's used early, has a drastic clinical effect on a lot of patients. Now, just like every single tool we have, of course it's not going to work 100% of the time. Of course, when you approach something like this, you need to use multiple things, like we've talked about in this show so far. You can't just rely on one thing. But I clinically believe, and I have lots of colleagues that have clinically seen this be extremely helpful in the outcomes of patients, especially early and even some late-stage patients. I know that it's been basically attacked, and I think there's other driving factors going on, which has a lot to do with what pharma is doing and the sheer amount of money you make when you have a drug or a patentable thing versus a generic drug out there. And if we were truly in the midst of caring about helping people, we would say, hey, let's try this. Let's invest some research dollars into really looking at this and seeing, is this something we should continue to pursue, or is this something that doesn't work? And we should also have studies set up of what is the exact timing that it should be given, and thoroughly flesh those things out. And I find that it's a disservice in what we're doing with science is we're totally just brushing it off and saying, no, that doesn't work. There's no way that some drug that was originally invented for parasitic infections and worms could be effective. And it's been kind of snowballed in that setting, which is extremely disappointing. If you look at the literature, you know, a lot of people, the news got in trouble because they were trying to say that, oh, hospitals are being overwhelmed because of the toxicity of this drug. If you look at the history of this drug, it's been used for a number of different infectious agents tropically. It's been used for skin conditions. And even there's a 2011 article talking about its use in asthmatics in reducing the mucus production, which you would think would be extremely important in any upper respiratory infection. It does have antiviral properties suggested in the research, and we even use it as a tool in oncology and cancer settings for patients. So it, in my opinion, and probably a lot of people out there, I think it's absolutely ridiculous that we're just totally throwing this drug under the bus without taking a hard look at it.
So you touched on a really important point. I mean, when you have a drug that's been out, first it's patented. I mean, they go through the whole study process, and it becomes patented, and then the pharmaceutical company makes a huge amount of money, and they're able to hold that for a certain amount of time. But then after that, it becomes available in the market, and anyone can produce that drug, which means that, they really don't make much money on it. So the way they make money is to come up with a new drug, and this is not new. And so here we have this huge crisis where, the pharmaceutical industry wants to, they can look upon this and say, we can find something that we can make a lot of money on, and obviously this is not it. So then they're looking more than towards things like vaccine or using remdesivir, for instance, another one that they can make quite a bit of money on right now. So is that what you're thinking as well?
Yeah, I mean, that's where I'm kind of leaning, because if you look at, when you dig a lot of the stuff on remdesivir, it's just like it really doesn't work that well in people when you give it to them long term and in the late crisis of it, like in the hospital setting. And for a drug to have a 25% renal failure, I mean, that's huge. If you're using a drug that has that kind of side effect profile, where it shuts down your kidneys, which, if your kidneys shut down, guess what? Your lungs fill up with fluid, which is horrible for what we're trying to do for these people that are going to ICUs and emergency beds. You better make sure that drug works very, very well.
for that kind of risk. And the papers that I read and the things that I searched through, it doesn't seem like it's something that it should be put at the top of our radar for that side effect risks. And for the other things that are coming out, like there's new antiviral drug that's coming out, and it seems to have its own side effects that are concerning long term. It looks like it may even work like some of our chemotherapeutic drugs in the way it works on cells, which then we got to wonder, what are the long-term repercussions of this? Is this going to cause mutagenic properties that may increase the risks of cancers later on? I think when we start exploring new things, we find out that, well, it's okay, let's just try it out now, but we're not thinking of the long-term consequences of these things. There's a problem with that, and we've seen that in history. We saw that with Vioxx. Things change, right? It was originally, this is the greatest drug ever. We gave it to people. Unfortunately, hundreds of thousands of people died from it, and then it was pulled. We also saw that, more recently with aspirin. Aspirin just a couple days ago, it was the shining factor for being used for people to take ongoing to prevent cardiovascular events no matter what. And then it got changed to only doing it with certain high-risk individuals to now, the risk-benefit ratio doesn't really make sense, so we're not advising people take aspirin routinely anymore. And that's after, hundreds of thousands of people have gone to the hospitals, have had bleed out, and other people have died over the years. We often see this history of this drug comes out, we use it, and then 5-10 years down the road, we find out, there's all these problems with it. It's scary when you have a new drug and you do that versus if you can find an old drug like ivermectin or metformin that has a very safe or low-risk toxicity and say, hey, we're going to try this and see what results we get. And if we are getting improved results, why not use it until we find something that comes along that's better with the same safety profile?
Yeah, and ivermectin, it's an antiparasitical drug as well. So, people that are experiencing maybe parasitical die-off, like bloat and loose stool and those type of things, and then they get concerned that this drug is going to be dangerous. In reality, it could just be they're cleaning out parasites.
Yeah, I know some of the stories where people have had more severe reactions to it. Likely, I agree with you, because you and I both treat people with chronic diseases, and we commonly see people with parasitic or worm infection that they don't even know about until we start treating them. And they get flare-ups, they get die-offs, and they start to feel really crummy. And I agree with you 100%. I think that probably a large majority of the people that are having adverse reactions like that are GI-related or mild neurological symptoms are related to them having an infection established that they didn't know about.
Yeah, exactly. And how about the hydroxychloroquine? What's up with that? Is that, should you do that in combination with ivermectin? Is it a standalone with, along with things like metformin, or is it safe? What's going on with that one?
I think hydroxychloroquine originally came out, and it was one of those that was combined with an antibiotic like doxycycline or azithromycin, and also zinc was in there. The big claim to fame with hydroxychloroquine was its ability to allow zinc into the cells. It was also a drug that was gaslighted and said it was toxic and dangerous, which, if you looked in the history, you saw no toxicity, no people getting heart disease from the drug. And most clinicians you talk to, we used it often for people with autoimmune disease. We used it in malarial cases for years, thousands of prescriptions without having any problems or toxicity. And when it was proposed as a supportive drug for COVID patients, most of that dosing was extremely low compared to what you would see with somebody, say, with rheumatoid arthritis or another autoimmune disease that would be on it for years at sometimes 2 to 3 times the dosage. And we're talking this was anywhere from 7 to 10 days. I mean, that's nothing compared to years and years and years of taking the drug. So I think it has a role. It does seem that ivermectin works better. I have now kind of transitioned in my clinic to using more ivermectin as part of my overall tools, because ivermectin does have that ionophore property, and it has multiple other things going on with it that is beneficial. So I know some doctors that still combine those. Classically, I find that I use ivermectin and sometimes doxycycline. If I'm not getting the result with the patient, say in 2 to 3 days, the clinical case is not improving, that's typically when I may layer some things on. I know some docs are just giving them ivermectin, hydroxychloroquine, and either azithro or doxy, and I don't have a problem with that. I don't see a toxicity issue with it, especially since it's being used for such a short period of time.
And also, I know things like vitamin C IVs. I mean, you touched about ozone and how important that was, and hyperbaric oxygen. You know, vitamin C IV. I mean, it's something that they used originally and did studies on in Asia and had great effects.
Absolutely, and not only, most people think of vitamin C and they think of, it's just an immune support, but what they were finding is it had such an amazing effect on kind of quelling or quenching some of the overreactivity or the cytokine and ROS generation from the immune system. You would have better outcomes with your patients doing it. And in Asia, I mean, they were given fairly low dosages compared to what maybe you and I will do, where it's 25 grams or maybe even 50 grams of IVC. So that's absolutely another tool. Is vitamin C is an amazing tool to add to this regimen as well.
Yeah, great. Well, Dr. Cochran, thank you so much for coming on the air and talking about this. It's something that I know a lot of people are wanting directions in, and they have concerns in the safety in using some of these repurposed drugs, and then to, feel a little bit more secure that, this can be a tool in their battle when they see, maybe themselves or their loved ones that they're struggling with COVID. So thank you so much for coming on the air today.
Thank you for having me.
Absolutely. That is it for today. You're listening to Health Made Radio. Remember to check us out at healthmade.co. Health is what you make it. 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 Health is what you make it.